coders are the people who are responsible for the funding that gets allocated to hospitals, because they assess records that then translates to activity-based funding for hospitals. The problem that exists is that there is an undersupply of clinical coders in Victoria, but also nationally.
BEU is getting students work ready for the course by actually providing tools that equip them with actual practical experience. I think that's the main draw of this course, that actual practical experience. The course would be beneficial for employers because it reduces that burden of training on organisations. These students are basically going to graduate from their course and be able to slip into a position and know what to do on their first day.
The benefits of doing blended learning with the Certificate for in Clinical Classification is I can study at my own pace. I can do a lot of my study work while the kids are at school or later in the evening. So instead of going to school one day a week, we actually have webinars at home. I can combine that with doing what I need to do at home, which is the whole purpose of blended learning, being able to have a good work-life balance while you're studying.
We're really pleased to say that we had 158 students enrol in the program from December 2017 to November 2018. And of the students who have undertaken that evaluation, the market research showed that a third of them actually had qualifications already, bachelor or higher level. 30% of them also said that they were considering a career change. So people are looking at using vocational education and training as their springboard for a different career path. And what we're really lucky to have at Victoria University Polytechnic is that the blended learning model that we use has been a national award winner in terms of being the best learning model in Australia in 2017. Victoria University Polytechnic's committed to addressing health industry shortage in clinical coding and setting a new benchmark for the profession. It powerfully draws on the training expertise of our own educators, but also the occupational knowledge of our workplace partners. And along with the technical capacity of the simulated training tool software, this addresses what we know to be a genuine workforce challenge.